Dr. Lawrence Broder, MD, owner of Bliza Med Spa with offices in Round Rock, Cedar Park, and Austin, Texas. I wanted to talk to you today about the new lift we have developed called the Neojuvenescence Lift. The Neojuvenescence Lift is a facelift alternative that we developed from our years of experience with various procedures. And as a result, we've combined a series of procedures in a novel way to give you the best results. Let's talk about the traditional facelift. The traditional facelift, they just kind of pull your skin back, and we've all seen those patients with the facelift appearance of that pulled back look, cat eyes, the lips pulled up. It looks unnatural. It does not look young. It just looks like a person that had a facelift. Plus, they're very expensive. There's a lot of downtime, and at this point, the poor results, patients don't have time for them. So we developed something called the Neojuvenescence Lift, combining several procedures. So let's just talk about aging, the aging face. When you look at a young person's face, their face is in the form of an inverted triangle. Most of the volume of their face is up in their cheeks, in their brow, and the upper part of their face. So that's where their volume is. They usually have tight jawlines and smaller chins, and this gives them that inverted triangular appearance. Then as we age, this volume in the temple and brow disappears, and then the cheeks start to descend almost to the jawline, where we start to develop jowls. And this is what happens as we get into the aged face. The volume has been lost in the temple and brow and has come down to the jowls and around the mouth, and then it gives the triangular shape that we all see as the aging face. So what do we do differently with the Neojuvenescence Lift? Our goal with the Neojuvenescence Lift is to actually deal with the problems that are causing this, not just to pull the skin tight and try to cover it up. The regular facelift does not deal with the problems. What we do is, one, fat transfer. We take fat from somewhere around your body. We all have enough fat to transfer from somewhere, and then we take those living fat cells and transfer it to the face to revolumize the face. Our goal with the fat is to put fat in the upper part of the face, by the temples, by the brow, and by the cheeks, to start to rebuild that triangle up here. That already will make a big change. The other thing we'll do is the fat in the lower part of the face, around the chin and the neck and the mouth, we're going to use smart lipo laser liposuction to go in here, melt some of the fat, and remove it. So our goal is to take some of that fat out of the lower face. So we're actually redistributing fat from the lower face to the upper face, and that's what makes a face look youthful. Good thing is, this is your fat, you're in living fat cells. There's no chance of infection or allergic reaction. Plus, fat cells, we're finding out, are full of stem cells, 500 times the amount of stem cells of bone marrow. And these stem cells can actually become any new cell in your face, like bone, skin, fat cells themselves. So what we also add to that is something called PRP. And PRP, or the vampire facelift, uses platelets taken from your blood, a small cell that we all know controls bleeding, stops bleeding, and starts tissue repair. We activate those platelets to release their growth factors. So here we have all the growth factors in your body, a natural source. We add that to the fat, and we also place it on the surface of your skin to penetrate and start to activate those stem cells and to start tissue repair. The other thing we do is we deal with the surface of the skin. We will do dot therapy, CO2 fractional laser therapy, to penetrate your skin, make millions of little perforations using the CO2 laser, and that will cause your skin in 3 to 4 days to peel. You'll have a fresh new skin. We'll take off all the visible signs of aging, like wrinkles and brown spots. And then the other thing the heat does, it goes into the dermis, the deeper layer of skin, and stimulates collagen formation, and that will do overall skin tightening. We will even add some PRP, the platelet-rich plasma, to the surface. Since you have those perforations in your skin, that PRP can go right into your dermal layer and further make new skin and activate stem cells. So that is our overall goal: redistribution of your fat, stimulation of collagen, stimulation of stem cells, new fat, new stem cells, and stimulation of collagen remodeling. This is the future, and if you compare the price to a normal facelift, it's a fraction of the price. There is about a week of downtime, but less than a facelift, and the results are much better. So I urge you to come by, take a look at our pictures, look at our website, come in for a free consultation. But this is a state-of-the-art facelift alternative, and it will give you the results that you've always wanted.